Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care. Speaker, as I explained in a letter to the Minister at the beginning of this year, the Parry Sound area is suffering from a doctor shortage. The situation was further aggravated by the tragic loss of one of our prominent physicians this past December. Parry Sound does not have a permanent walk-in clinic, though a temporary, occasional clinic has been established by local doctors who are volunteering to address the needs of the community, and I want to thank the medical professionals for stepping up to help. Even so, with 1,200 patients suddenly without a primary care physician, we are seeing many go without adequate care. My office has heard from many complex care patients who are concerned for their health without access to consistent monitoring. So my question, Mr. Speaker, is does the minister have any plans in place to help recruit physicians to high-need locations like Parry Sound?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and I always appreciate the questions from the member opposite, especially on an issue as important as this. And we know, Mr. Speaker, despite the fact that an estimated 94% of Ontarians have access to a primary care provider, that may be a physician, it may be a nurse practitioner. We have 25 nurse practitioner-led clinics across the province, so 94%. But there's more work to be done, and we've made that commitment so that everyone in this province who does desire or require a primary care provider can find and become attached to that primary care provider, Mr. Speaker. So we have a number of programs in place. In fact, just recently, we announced a commitment to ensure that every sub-LHIN region, Mr. Speaker, of which there are approximately 80 around the province, will have an interdisciplinary primary care team. And we're putting the funding into that program, that initiative, to ensure that across the province, including in the member opposite's riding, that we have access to those important providers.
Thank you. Supplementary.
Well, thank you, Mr. Speaker. Back to the Minister of Health and Long-Term Care. One of the options available to alleviate a shortage of doctors is to have a locum, or a doctor from another community temporarily practice in the area. But the criteria to qualify for locum are based on the number of doctors in a practice rather than on the need of the community. So even in a community like Parry Sound with a high need, the rules don't allow for a locum. So my question for the minister, will the minister review the situation in Parry Sound and approve a locum until more permanent doctors can be found for the area?
Thank you. Minister.
Well, thank you, Mr. Speaker. And again, I appreciate the question. In fact, I worked at Parry Sound Hospital way back shortly after graduating from medical school. It's hard to imagine it was 1985, so it's 33 years ago this year. But, Mr. Speaker, I am absolutely committed to ensuring that those providers, be they physicians, nurse practitioners, nurses, occupational therapists, the whole gamut of healthcare professionals, that somebody in the NDP, I think, is just doing the math now in terms of how long that was ago, and I can hear them out of the corner of my ear. But I'm happy to work with the member opposite, because this is not only important to him, it's important to me, so we'll see what we can do.
Thank you. New question, the member from Welland.